Welcome to the Genesis Health Show. This is your host, Rene David Alkalay. This show is dedicated to exploring complementary and alternative therapies. In today's program, we'll look at mind-body medicine. We'll take a general overview of what that means. There are major areas of complementary and alternative medicine called CAM, and this should not be viewed in any way as a comprehensive review of this topic. Rather, what we intend here is to provide a sense of the challenging research that's taking place and opportunities, particularly in CAM approaches for better health. To find out more about any of the topics that we may touch upon, I can be reached through our website, which is genesistree-of-life.com. Perhaps the best way to begin would be with a quote from Hippocrates. Hippocrates, the father of medicine, said, "I would rather know the person who has the disease than to know the disease that the person has." I think this says clearly what one of the problems of our modern healthcare system is. We've become so focused on the disease that we've forgotten the patient. By way of introduction, mind-body medicine focuses on the interaction among the brain, the mind, the body, and our behavior, and on the powerful ways in which emotional, mental, social, and spiritual, and behavioral factors may affect our health. In a mind-body model, we regard as fundamental an approach that respects and enhances and empowers each person's capacity for self-care. We've given much of our power over to others, and the direction that we'd like to suggest here is that we reclaim that power. We reclaim it through self-knowledge. We emphasize techniques that are grounded in this approach. Let me briefly define the scope of the field of mind-body medicine. Typically, we focus on intervention strategies that are thought to promote health. Strategies such as meditation, hypnosis, visual imagery. There's a field today that's growing rapidly of imagery therapy, Tai Chi, relaxation response, yoga, biofeedback, and certainly a series of cognitive behavioral therapies, group supports, autogenic training, and last but by far not least, spirituality. The field of mind-body medicine views illness not as something simply to be overcome, but as an opportunity for personal growth and transformation. Seen in this way, healers or healthcare providers act more as guides, as educators, and as catalysts in this process of self-knowledge, self-care. Mind-body interventions constitute a major portion of the overuse of or the overall use of complementary and alternative medicine. A little bit of background. The idea that the mind is important in the treatment of illness is integral to the healing approaches of many of the traditional systems of healthcare, certainly integral to Chinese medicine, very integral in the field of Ayurvedic medicine. These systems date back thousands of years. And in the West, or in Western civilization, the same approach was used by Hippocrates. He recognized clearly that the moral and spiritual aspects of healing were as significant as any medications that might be given in his day, herbs and foods, for example. He believed that treatment could only occur with a consideration of the attitudes that a person will have, the environmental factors that were part of the patient's life, the natural remedies that might be used. This was an integrated approach. And when we speak of mind-body medicine today, we're certainly considering this concept of integrative medicine. Integrative medicine takes this very approach while not avoiding the use of currently traditional approaches, as, for example, in cancer with chemotherapy and radiation and perhaps surgery. There's an awareness, a growing awareness, that chances for survival may be increased dramatically with an integrative approach in which significant lifestyle changes also take place. And these lifestyle changes, of course, would include the diet, relaxation response, perhaps massage therapy, yoga, and any of the other therapies that we mentioned earlier. While this integrated approach was maintained in traditional systems in the East, our Western world went in a different direction. In the 1500s and the 1600s, 16th and 17th centuries, there was a great separation of the spiritual dimension and the emotional dimension. And this separation was from the physical body. It began with a total redirection of science. It was during the Age of Enlightenment, of all ages, that this separation really became more prominent. During this time, there was a drive for controlling nature more so than had taken place in past times. And much of that came about because of technological advancement. So we advanced in what way? There was the development of the microscope. There was also a way to measure blood pressure, the blood pressure cuff. Surgical techniques became very refined. A number of other technological advancements. And these, taken together, made us aware of a cellular world. while that was an advancement of science, it really hastened that separation. It seemed to be far apart from the world of our beliefs or our emotion or our spiritual connection. Later on, there was a discovery of bacteria. And still later, there was the development of antibiotics. With the development of antibiotics, of course, this hastened the demise of the idea that our health might be influenced by the mind, by what we believed, by what we felt, what we thought. Fixing or curing, therefore, of an illness became not a matter of curing an individual or taking an individual as a whole person, but it became simply a matter of technology. And this technology took the place of the healing of the soul, let us say. So the technology might have been a great boon, a great benefit to us, had it been next to these other elements. But instead it replaced them. And this was an error, which we're now becoming aware of. As we separated the mind and the body, the mind sciences began to develop, and that actually took us further away from this path of integration. Because as the mind sciences, as psychology developed, the early fathers of psychology, concepts were formed. And these concepts had to do with the unconscious mind, the emotional impulses, certain delusions of cognition. And this actually strengthened the perception that the diseases of the psyche were not real. Or, put another way, that they were not really related to physiology or biochemistry. So now man became separated into a psychological and emotional being and a biochemical and physiological being. And these two elements apparently were separate and could be dealt with separately. This was a dualism that, of course, did not serve us well, and the results of which we're now seeing in a healthcare system that is simply not effective any longer. In sometime in the 1920s, a man named Walter Cannon showed the direct relationship between stress and the neuroendocrine responses in animals. And he coined a phrase called fight or flight. He described this primitive reflex of sympathetic and adrenal activation in response to perceived danger and to environmental pressures. These pressures being, of course, any radical environmental shift in temperature, for example, cold or heat. Also at that time, there was a further definition of the effects of stress and distress, and this came through Hans Selye. At that same time, there were many technological advances in medicine, and these advances could identify very specific pathological changes And of course, new discoveries came about in pharmaceuticals. And these were occurring very rapidly. So the disease-based model, the search for a specific pathology and the identification of cures that were external became paramount. And this was true even in psychiatry, which now moved away from working with the mind, but with biochemical changes and therefore pharmaceutical drugs that would make those changes, bring those changes about. During World War II, on the beaches of Anzio and other beaches, morphine for the wounded soldiers was in short supply. So a doctor named Henry Beecher discovered that a lot of the pain that soldiers experienced from wounds, from lost limbs, could be alleviated, could be controlled by saline injection. The soldiers being told that this was morphine. And so that was the beginning of the term, he coined the term called the placebo effect. His subsequent research actually showed that 30 to 40% of a therapeutic response to any treatment is, in fact, or could be, in fact, the result of belief. To this day, we have ongoing investigation into this placebo effect, and there's continuing debate about its efficiency. Since the 1960s, as we move closer to our own time, mind-body interactions, of course, have become greatly researched. It's an expanding field. The evidence for benefits for certain approaches, such as biofeedback, hypnosis, for example, these are very good. The research is very solid. And certainly for cognitive behavioral intervention, a cognitive behavioral model. So that's quite strong, and we have good evidence-based research. Other areas are not quite as well researched yet, but they're beginning to be. Areas such as yoga and meditation. Over the past 20 to 30 years, there's been considerable evidence that psychological factors play a great role in the development and progression of coronary artery disease. There's evidence that mind-body interventions can therefore be effective in the treatment of these diseases, coronary artery disease, and it can enhance the effect of standard cardiac rehabilitation. Mind-body interventions have also been applied to various types of pain. There are a number of clinical trials that indicate that these interventions may be very effective as an adjunct in the management of arthritis, and with reductions in pain maintained for up to a good number of years, reductions in the number of visits to the doctor's office. When we apply these interventions to more general acute and chronic pain management, we find very good results for headache, for low back pain. There's sufficient evidence today of the effect, although the results are very much based on perhaps the patient population or the intervention that's being studied. We still need a lot of evidence in these areas, but there is evidence from multiple studies with various types of cancer patients. I worked for 1.5 years with cancer patients at Beth Israel Hospital, working with a mind-body model of meditation and visual imagery. And both from my own experience and from many studies that are taking place, it's clear that there's an improvement in mood, quality of life, better way of coping, and certainly an amelioration of disease and treatment-related symptoms, such as during chemotherapy, symptoms such as nausea or vomiting or pain. These interventions can alter various immune parameters, but it's still unclear whether these alterations are sufficient to have a real impact on the disease. It would seem to me that if we can alleviate stress, lower pain, increase the immune system, that it's not a far leap of the imagination or of reason to say that there would be an impact on the disease. Can we prove this? It's going to be a little difficult as of yet, but these are the studies and the clinical trials that are taking place. We've spoken about immunity. There's considerable evidence that emotional traits, both negative and positive, influence our susceptibility to infection, for example. If we have systematic exposure to some type of virus, a respiratory virus in the laboratory, individuals who have high levels of stress or negative mood have been shown to develop more severe illnesses than those who have less stress, who are happier, or have positive moods. Recent studies, in fact, suggest that the tendency to report positive as opposed to negative emotions may be associated with some resistance to objectively verified illness. So these type of studies are supported by longitudinal studies that point to some association between psychological or emotional traits and the incidence of infection. I'd like to touch on the subject of meditation for a moment in the time that we have left. Meditation is one of the most common mind-body interventions. It's a conscious mental process, and it induces a set of integrated physiological changes. Benson referred to this as the relaxation response. We can measure, identify and measure with functional magnetic resonance imaging, that's fMRI. We've used this to identify and characterize the regions of the brain that are active during meditation. This research suggests that some parts of the brain known to be involved in attention and in the control of the autonomic nervous system are activated. And by being activated, they provide a neurochemical and anatomical basis for the effects of meditation on various physiological activities. There have been a number of recent studies that involve imaging, and they're advancing our understanding of these mind-body mechanisms. An example, meditation has been shown in one study to produce a significant increase in left-sided anterior brain activity. That type of activity is associated with positive emotional states. In the same study, meditation was associated with
increases in antibody titers to influenza vaccine. And that suggests a potential linkage among meditation, positive emotional states, localized brain responses, and improved immune function. Talking about the placebo effect, or the placebo response. Placebo effects are thought to be mediated by both cognitive and conditioning mechanisms. Until recently, we knew very little about the role of these mechanisms in different circumstances. Now we have research that's shown that placebo responses are mediated by conditioning when unconscious physiological functions, such as hormonal secretion, when these functions are involved, whereas they're mediated by expectation when conscious physiological processes such as pain and motor performance come into play, even though a conditioning procedure is carried out. We can see from positron emission tomography, for example, PET, from scanning of the brain, that's providing evidence of the release of the endogenous neurotransmitter dopamine in the brain of Parkinson's disease patients in response to placebo. Evidence indicates that the placebo effect in these patients is powerful and is mediated through activation of the nigrostriatal dopamine system, the system that is damaged in Parkinson's disease. When we look at this result, what does it suggest? It suggests that the placebo response involves the secretion of dopamine, which is known to be important in a number of other reinforcing and rewarding conditions. There may be mind-body strategies, therefore, that could be used in patients with Parkinson's disease instead of or in addition to treatment with dopamine-releasing drugs. We're coming to the end of the half hour that we have. There's a great deal more that we need to cover, certainly, even in expanding on what we've already spoken about. And once again, I can be reached through our website, genesistree-of-life.com, for more information. And I look forward to being with you in a future program where we'll continue to explore complementary and alternative medicine. Thank you for being with me. God bless.